of my favorite grand rounds to give is that this is the golden era of cardiology. We live in an incredibly exciting time. 2017 is predicted to be the year that cardiovascular disease drops to the #2 cause of death in the United States. Cancer will be #1, and we've driven cardiovascular disease down to the #2 slot. A lot of things have gone into making this happen. Treatment of high blood pressure, high cholesterol, new technologies. In the last couple of years, there's been exciting things that should help continue to drive that down. First of all, the SPRINT trial, a high blood pressure trial sponsored by the National Institute of Health. 9,000 patients randomized to what is the optimal blood pressure, treatment to below 120 versus treatment below 140. The trial had to be stopped early, 3 years and 3 months into it, because of outstanding results. It was considered unethical to continue the trial due to the fact that there was a 16% drop in heart attack rate, a 43% in cardiovascular mortality, and a 26% drop in overall mortality. So aggressive treatment of high blood pressure will probably give us more benefits down the road. A second important trial is the new introduction of PCSK9 inhibitors. For years, all we had were statins to treat our patients with high cholesterol and high LDL. Now we have the new PCSK9 inhibitors. Trials have shown a 50 to 60% drop in LDL levels when added to maximum dose statins. There are no outcome trials yet, but we anticipate that the outcome trials will be as impressive. And finally, a third area, heart failure. We haven't had good medication to treat heart failure, but now in those patients who have systolic dysfunction and decreased ejection fractions below 40%, the Paradigm trial with the new Entresto drug, which is a combination of angiotensin receptor inhibitor and a nephrolysin inhibitor, have had incredible outcomes. There's a 15% drop in overall mortality and a 20% drop in cardiovascular mortality, as well as a significant decrease in hospital readmissions. So with better treatment of high blood pressure, cholesterol, and a new drug for heart failure, I anticipate there's going to be a big improvement in cardiovascular outcomes, and we continue to live in the golden era of cardiology. As I tell my patients all along, I just have to keep you alive to the next breakthrough.